As part of the network cost action, we wish to provide researchers with examples of how they may integrate patient and public involvement into their future work. We recognise that little guidance exists regarding how best to conduct this type of work, and so we're producing a number of videos outlining other research that has undertaken patient and public involvement, highlighting some of the main points around it. For this particular case study, we're considering some of the structures that might be needed in terms of developing a patient and public advisory group. To do this, we're using the Mobilised study as an example. Mobilised is a large IMI-funded European public-private partnership consortium. The focus of this research group is the measurement of real-world walking. The project recognises that there's a big difference in how people walk in the lab versus their usual day-to-day lives. And the aim of the project is to use wearable sensors to develop new algorithms that can accurately measure walking in the real world, with the aim of producing new digital outcome measures for use within clinical trials. Mobilised is a complex study involving both technical and clinical validation of their algorithms across 4 patient cohorts: Parkinson's disease, multiple sclerosis, hip fracture, and chronic obstructive pulmonary disorder. It has clinical sites across Europe and multiple consortium objectives, meaning that there are many different perspectives and stakeholders that need to be considered. The challenge for this group was to integrate patient experiences in a way that ensured that people from across Europe and representatives within each of the selected conditions were included. Mobilised recognised that in order to embed the patient voice in its work, it needed to embed the patient voice in its governance structures. So it developed 2 patient and public groups, a PPI board that operationalised its activities, and a patient and public advisory group that advised on how best to integrate the patient perspective in various research tasks. Once these groups were set up and functioning, they recognised the need to have subtasks to deal with specific topics that were both important to patient advisors, but also that linked clearly to its research objectives. It therefore set up these subgroups, bringing researchers, industry partners, and patients together to tackle specific tasks as one. The impact of these structures can be seen across each of the levels of patient involvement and throughout the various aspects of the research project. Patient advisors and the outputs generated from the subgroups include the co-development of study protocols, co-production of webinars and public-facing videos of key results, the use of interviews and questionnaires to better understand the lived experience of patients, and co-authorship of seminal research results. The consortium has documented its processes and the lessons they've learned from them through freely available webinars that they've designed alongside patient advisors, and a publication whose preprint is currently available for viewing, which was co-authored by all public advisors in their consortium. Briefly, their recommendations are listed here, but essentially they highlight the time, money, effort, and awareness that is needed to set up and refine well-functioning public and patient involvement structures. They emphasise the need to have clearly defined scopes of work and terms of reference for their patient advisors, as well as reiterating the need to budget for this work, both financially, but also in the time that it takes to complete effectively. More information regarding the work of Mobilised can be found on their study website, their YouTube, LinkedIn and Twitter channels, and in their publications to date. This study is just one example of how public and patient involvement structures can be created and what impact they have, and their recommendations may be useful for those considering submitting a grant application or who are looking to start their own public and patient advisory groups in future.